Hello and welcome. So, today we'll just be talking about some nursing tips on how to accurately measure vital signs. All right, let's dive in with a little bit of introduction. It is essential to know that vital signs is very important in nursing, and nurses should know that this is the baseline for measuring the patient's condition to detect if there's any changes in a patient's condition, to monitor the progress of the patient, and to also give a guide to clinical decisions being made about the treatment plan of a patient. So, vital sign is an essential indicator of a patient's overall health status. Vital signs can also be said to be the alarm system of the body. This is what goes ding dong and like a pointer to if there's going to be a problem or if there's a progression of a problem in a patient's condition. So even before a patient shows any signs and symptoms of an illness, the vital signs will let you know if there's something going on in the patient's body. So accurately, consistently monitoring vital signs saves lives of the patient. So importantly, vital signs matters in a lot of ways. First, it serves as a baseline assessment for a patient. That means if you're meeting a patient for the first time and you obtain their vital signs, that serves as a starting point for comparison throughout the patient care. Also, vital signs serves as an early detection for deterioration, like if there's a sudden change in the vital signs of a patient that might indicate a serious issue, like if the temperature keeps skyrocketing and the blood pressure keeps dropping, you might be thinking of sepsis, shock, or even stroke. Also, vital signs matters in monitoring the trend of the patient. Like if you keep monitoring the vital signs, you can see if the treatment you're giving to a patient is actually working or it's getting the patient to worsen. Also, vital signs helps to make clinical decisions. Like if you have a patient that is having low blood pressure, you have to pump in fluid, and this helps to make the physician or the treatment team to make a decision about the clinical decision about the patient's care. A vital signs taken also can be a legal documentation of importance through safe practice and whenever there's a legal problem about a patient. Vital signs helps nurses, most importantly, to communicate clinical data to other healthcare professionals. Like, okay, these are the tools that we're gathering about a patient that can help in research and help you to see that, okay, this is what we need to do for this patient more. This is the progress we've made about this patient. Also, vital signs help to assess the response to treatment. For example, if a patient blood pressure responds to medication, you will know, and if a patient temperature responds to the treatment that was given, then you know. So, here are some tips to help in obtaining vital signs accurately. So ensure that the patient is at rest. At least wait for 5 minutes if the patient has been active. Explain the procedure to the patient. This helps to reduce anxiety and to make them understand the process of what you're going to do and for how long. Use proper equipment size, especially for the blood pressure cuffs. We have the adult cuff, the large cuff. Make sure the children's cuff. Make sure that you use accurate blood pressure cuff for the patient, size for the patient that you have, and document immediately. Record the time, the value, and relevant conditions like after ambulation, or patient is sitting down, or patient is standing. Just make sure that you recommend in time and document immediately so that you won't forget what you have, the values that you have. To measure the blood pressure, make sure that you use the correct cuff size, and make sure that the cuff size actually encircle 80% of the arm that you're using. Keep the arm at the heart level and supported and relaxed. Avoid measuring overclothing if you can. Deflate the cuff slowly. That's if you're using the manual cuffs for accurate reading. Wait for 30 minutes after caffeine, smoking, exercise before measuring. the blood pressure. So if you're measuring the pulse manually, make sure that you use the radial artery for the routine checks. But if you have irregular pulse, please make sure that you use the apical pulse if you're actually obtaining the pulse manually. You have to count for 60 seconds, 1 minute if the pulse is irregular. But if you have a regular pulse, you can count for 30 seconds and then multiply by 2. Also note the rate, the rhythm, and the strength of the pulse that you're obtaining. It has to be, just make sure that if you count that the rate is regular, the rhythm is not too fast, and then the strength is strong for you to feel. So to measure the temperature, it is important to be consistent with the method at which you obtain the temperature. Like we have different methods. You can obtain your temperature through the oral orifice. You can maintain it through the tympanic, the axillary, or the rectal. So whichever method you're using, make sure that you're consistently using the same site to obtain the temperature. You have to wait for like 15 to 30 minutes after eating, drinking, or smoking for oral reading. Rectal temperatures are usually like zero point 0.5 to 1 Fahrenheit higher than the oral, and axillary is about 1 Fahrenheit lower than the oral. So I know most people tend to use the oral temperature because they say that's the most stable temperature of the body. So to count the respiration though, you have to make sure that you count without letting the patient know that you're counting so that the patient won't alter their respiration or their breathing by themselves. So you have to watch that the chest rise and fall and count for 30 seconds times 2, or 60 seconds if like 1 minute if you see that the breathing is irregular. So observe for the depth, the rhythm, if they're using any accessory muscles in breathing. So be sure that importantly the patient don't know that you are actually counting their respiration. To obtain the oxygen saturation, though, you have to place the probe on a clean, warm, dry finger. Sometimes you have to rub the finger if the patient is cold to be able to get the oxygen saturation of the patient. It is important also if patient can remove the nail polish and artificial nails if needed so that you'll be able to obtain the oxygen saturation because this affects the reading. Poor perfusion could be because of cold extremities, low blood pressure, and this would actually affect the patient's reading. So be mindful of that. So that's the general tips for measuring patients' vital signs accurately. But there are things that we should watch out for if there's a sudden change from baseline, if there's an irregular pulse or breathing, if there's changes in the blood pressure with symptoms like dizziness and fatigue, when there is fever, hypothermia with abnormal findings, it's something that should be treated and take note of immediately. Thank you so much for joining me today. Like, subscribe to this channel. Let me know if there's any other thing you want me to talk about. Thank you.